My name is Joy Kadi from North Coast Medical Training College. I take community health and development as my course, and I'm hereby today to take you through a brief topic on HIV prevention among the youth. I know that HIV is not a new word nor a new topic, so I'm going to define what HIV is. And from my brief points here, HIV is a virus that attacks the cells of the body, making a person more vulnerable to other infections and diseases. And HIV in full stands for Human Immunodeficiency Virus. HIV causes AIDS, and AIDS in full is Acquired Immunodeficiency Syndrome. I hope that you now know what HIV is and what HIV causes. From there, I'm going to the next step, which is the stages of HIV. HIV has 4 stages, which states as infection, asymptomatic stage, symptomatic, and incubation, or the progression of HIV to AIDS. I'm going to talk one by one, which I'm going to start with the stage of infection. This is whereby HIV replicates in the body after infection. The immune system reacts to the virus by developing antibodies. So this means that HIV now replicates inside your body. The second stage is what is called as asymptomatic stage. This is whereby you have the infection but there are no outright signs or symptoms. A person may look healthy, but in the real sense, he or she, HIV is weakening their immune system. The third stage, which is the symptomatic stage, this is whereby now the immune system is completely damaged and weakened by the HIV. So the symptoms can now begin to show up, and some of the signs and symptoms are as follows. You may have fatigue or weight loss, mouth ulcers, and severe diarrhea. Those are some of the few signs and symptoms that you may have. The fourth stage and the last stage is the progression of HIV to AIDS. That is self-explanatory. Okay, those were the 4 stages, and now I'm going to the signs and symptoms of HIV and AIDS. As earlier, I say that some of them are fatigue, fever, loss of appetite, pain in the areas of the abdomen. You may have dry cough, persistent diarrhea, ulcers, or white tongue. Those are some of the signs and symptoms of HIV. Okay, I'm going to take you through how HIV is transmitted or how HIV is being spread from one person to another. One, you can see here is that HIV can be transmitted from one person to another if you have vaginal or anal sex with an infected person without using condom. That is self-explanatory. The other point is through mother to child, through breastfeeding or during pregnancy. The next point is when you have deep or open mouth kissing with a partner who has HIV or with a partner who has sores or bleeding gums. That is another way in which HIV can be spread. The next point is that if you have contact between wounds and HIV-infected blood or blood-contaminated body fluids, that means you can easily spread HIV and AIDS. The next point is that when someone who has HIV bites you, it can easily spread HIV and AIDS. And the last point which I have here is through sharing of injections during equipment like needles with someone who has HIV. It can easily cause HIV and AIDS. Those are some of the ways of how HIV can be spread from one person to another. Okay, while I briefly wind up, we have preventive measures of HIV and AIDS. How can you prevent HIV? Because you've seen here how HIV can be transmitted. So I want to talk about the preventive measures of HIV and AIDS. You should get tested and know your partner's HIV status so that you may be safe. Another point is you choose the less risky sexual behaviors so as to harbor the HIV and AIDS. Another point is to use condoms the right way. The next point, you limit the number of sexual partners so that you may be safe and healthy. The next point is you get tested oftenly and get treated for the STDs, which are the sexual transmitted diseases. You avoid sharing needles You limit or eliminate drug and alcohol use before and during sex. The next point, you can abstain. Through abstinence, you may not get infected with HIV and AIDS. You can also use diaphragms and other cervical barriers. Okay, those were the preventive measures, and now I want to talk about the last thing. How can you treat HIV and AIDS? We all know that HIV does not have cure, but you can use something that can make the virus to progress slowly and slowly and slowly towards your body. So you can strict and adhere to something that is called ARVs that can slow the disease's progress as well as prevent secondary infections and complications. So my summary about this, I talked about what is HIV, I've talked about the stages, I've talked about the signs and symptoms, how HIV is transmitted, and the preventive measures, and lastly, how can you treat HIV and AIDS. So on my conclusion point, I want to conclude that we both stay safe by adhering to the preventive measures of HIV, and we also know how can HIV be transmitted from one person to another, so that we may be knowledgeable about HIV and stay safe and healthy. Thank you for your time, and thank you for your cooperation. Thank you.